So generally we have a lot of specialties in nursing, and for every particular disease condition that you know, there must be a nurse for that condition. But you're not going to see all of these specialties in every country. You mostly see most of these specialties in advanced countries. So my top 10 is going to be ophthalmic nursing. So these are nurses that are specialized to care for patients with visual impairment, eye disorders, eye problems, anything that is related to eye. Okay, and what these particular nurses do is that they assist in surgeries, surgery in the eye. They conduct eye assessments. So in the hospitals, we have eye clinics, we have eye centers, also special hospitals, eye centers. You find all of these nurses there. So these nurses are specialized in caring for patients with joint pain, fractures, anything generally that has to do with bone diseases, manage pain, because most of these conditions come with a lot of pain, and also to educate the patient on how to go about mobility, how to go about movement after leaving the hospital, during the stay of the patient in the hospital, and even after leaving the hospital. My number 8 on the list is oncology nursing. So oncology nurses, from name oncology, it has to do with cancer. So these are nurses that generally care for cancer patients. When such patients are in the hospital, these nurses administer chemotherapy, medication to these patients. They give, support throughout the stages of, the treatment. Anybody can come down with cancer. We have a lot of cancer cases now. When you get to see cancer patients in the hospital, that's when you're going to know that these people actually need all the nurses that they deserve. So these are the people called OBGYN. So these nurses are specialized in caring for women in the aspect of their reproductive health. They care for pregnant women, they care for women after delivery. So it's generally women's stuff, reproductive health, pregnancy, childbirth, labor, after delivery, anything that concerns postpartum. They give education to women about things like menstrual disorders, things like menopause, and everything that has to come with menopause. This field actually sounds very interesting, and it's a field that I'm kind of considering, not because it offers more money, but because of the impact I'll be able to give. I think I would like to work with women, because women go through a lot of things, especially in this part of our northern part of Nigeria. You guys, I'm not discriminating on anybody, but here in northern Nigeria, you see the way a lot of people like to cover themselves. You do not know what they're actually covering. They are covering a lot of pain. They are covering a lot of things. Women, especially, they are covering a lot of things. So if when some of these women come out to open up to you, to tell you what they are going through, and the thing is that in the community, they cannot just come out and say it. Most of them will even be discouraged from going to the hospital, so they have to resort to some kind of traditional treatment, of which most of these traditional people are not even that traditional anymore. So they go through a lot, and I feel like I want to be like a bridge, a gap in between these women and the real medicine. This is another specialty that I fell in love with when I was doing my clinical posting. Nurses in this specialty give care and support to little babies, children, and adolescents. Children are the ones that come down with a lot of diseases, a lot of infections, and when these disease conditions are not properly managed, it will be very easy for a child to just give up. That explains why in the past we usually have a lot of child loss. You're going to see a woman telling you, "Oh, I gave birth to a total of 10 children and I lost 5, so I have just 5 children," or "I gave birth to 7 children and only 4 are alive." And then when you check, you're going to see that the reason these children died is just because of maybe a little infection or a disease that could have been easily managed or was not managed properly, and that was what made the child die. This specialty is just a very, very interesting specialty, and it's one that you should consider if you love children. If you don't love children, please just run away from here, because you have to be very patient, you have to be very loving, you have to be very accommodating. Okay, a school nurse is a nurse, of course, that works in a school, so either a primary school or a secondary school, or a clinic in any tertiary institution. So this particular nurse is just in charge of the health of all the pupils or the students in the school. So it's not just only treating sick children. This nurse has to facilitate promoting good health for these students, teaching them about preventive measures, how to avoid diseases, how to avoid falling sick, and then just their general well-being. Okay. The good thing about being a school nurse is that you are not in the hospital. You know, you are away from all that whole hospital bedside nursing where you have other health personnel, like you have the doctors, you have the pharmacists. So you're the one that call the shots, you're the one that decide how a patient to be treated, you're the one that is going to decide how to make sure that these kids in school are always healthy and ready to learn. It comes with some allowances, which is extra money, and yeah, it's going to be psychiatric nursing or mental health nursing. So please watch my previous video where I spoke about nurses salary. I mentioned that psychiatric nursing is a field where you can be paid more, especially if you get to work in the specialist hospital, that's a psychiatric hospital, or generally even as a nurse, if you are just able to work in the psychiatric hospital, you'll be paid way more than other nurses that work in normal hospitals. And then abroad, you are even going to be paid way more. You are highly needed, you are very needed, you are always needed. So these nurses, they assist patients that are having mental disorders. Mental disorders does not only mean that you're a mad person walking on the street. Mental disorders can range from depression to mania to psychosis. So it's still a good field if you want to go into it. Psychiatric nursing, I don't know, I just do not have that much connection to psychiatric nursing, but who knows, I may end up being a psychiatric nurse, right? So peri-operative nurse, this is the nurse that specializes in the care of patients before surgery, during surgery, and after surgery. Okay, they are mostly called theater nurses, surgical nurses, operating room nurses. So these nurses, they prepare patients before surgery. Before surgery, there are a lot of things that has to be done. You know, you have to seek consent, you have to give orientation to the patient, you have to take history of the patient, medical history. You have to check for a lot of signs on the patient before the patient goes into surgery. And then during surgery, they are there to assist the surgeon, and then after the surgery, they are also there to monitor the patient as the patient is coming off the anesthesia, and they also make sure that the patient is in good after surgery condition before handing the patient to the nurse in the ward, right? So you are just there in the theater, no much noise, away from the ward and the drama that comes with working in the ward, right? The next on my list is public health nursing. So they specialize in promoting health in the communities. They specialize in, giving education to prevent infections. They conduct community outreach programs to educate the public on diseases. They monitor and investigate patterns of disease outbreak to implement measures to control it. They also coordinate and they administer vaccines to children, adults, anybody. They provide also prenatal and postnatal care to pregnant women and babies. They give family planning services, a lot of things, anything that has to do with the public. These public health nurses are there to tackle it, right? My top one is anesthesia. So a nurse anesthetist, as they are called, is specialized in administering anesthesia during surgery. So a nurse anesthetist is different from a peri-operative nurse. Their roles are different. For the nurse anesthetist, they deal with administering the anesthesia, blocking of pain, sedating the patient, and anything that has to do with making sure that during surgery the patient does not feel the pain of the surgery or does not feel the sensation that surgery is going on. Most of these anesthesia medications are controlled drugs and they are very expensive. So these nurses are trained to understand this medication and understand their use. They also monitor the patient to ensure that as they are giving these medications, the patient is reacting accordingly. So basically that's what they do, but they are like mostly the highest paid, in that they collect call allowance and then they can work in different hospitals and collect call allowances from different hospitals. So that is why it's my top one. What specialty would you want to go into? For me, I've already mentioned the ones I may want to. I'm not sure yet. This is my top one. Doesn't mean that I want to be a nurse anesthetist. I've not yet fallen in love with working in the theater, like just standing. I don't, anything that's going to make me stand for long is what I'm trying to avoid. Even though I love the fact that you'll just be attending to one patient at a time and you won't have to be doing ward, bed to bed, and that ward nursing job. But then anything that's going to make me stand for long, I do not like it, okay, during surgery. So yeah, I hope this video video was helpful to you. If it was, kindly subscribe to my channel, give this video a thumbs up, and I'll see you in my next video. Bye.